Hi, I'm Lucian. I'm one of the medical emergency educators here with Life Support Learning Center and a paramedic here in Albemarle County. Today we're going to review proper IV technique. And to start out, first we need to prepare our equipment. So we have several different sizes of IV catheters, tourniquet, cleansing supplies, flush, and tegaderm, along with our gloves. After obtaining informed consent from your patient and explaining the procedure, and selecting a site that you'd like to use, we're going to clean it with a ChloroPrep. And we're cleaning in small circles, working our way outward and maintaining as sterile of a field as possible here. We're going to let that dry, and we're not going to touch that site with anything else from this point on. We'll apply our tourniquet proximal to the site, making sure we tie our tourniquet nice and tight. So we'll select our appropriately sized IV catheters. Just of note, here in the hospital, we have two primary types of IV catheters. We have the self-occluding catheters, as noted here, with the striped packaging, and we have the non-self-occluding catheters here in the normal packaging. So just be aware of what you're grabbing. However, I will demonstrate proper tamponade technique, because I think that's important technique to keep in mind, no matter what type of catheter you're using. Obviously, for an adult patient, we're typically not going to use a 22 gauge catheter, but for this case we will, just because we don't want to mess up our IV arm too much. So we'll allow our site to dry, making sure we have all of our other equipment, a pre-flushed extension set. Our tegaderm is within easy reach, and we have a sharps container ready to go. So we'll go ahead and perform venipuncture. We're going to go at about a 15-degree angle. Okay, poke on 3. You ready? 1, 2, 3. As soon as we get flash in the chamber here, it's a little bit hard to see in this IV arm, but you would see flash here in this chamber here. We're going to advance just slightly more before advancing our catheter. This allows the actual catheter itself to enter the vein, and is one of the major causes for missing IVs. So then we'll push the catheter over the end of our needle. We're going to hold tamponade here. We're going to withdraw our needle, retract it, and we're going to go straight into a sharps container. We'll connect our flush. Alternatively, if you were drawing bloods, now would be the time to connect your vacutainer. You can make sure that you have a good IV by drawing back slightly. You should see good blood return in your extension set. And then we're going to flush with saline. Making sure to remove our tourniquet. So now we'll go ahead and place our tegaderm on the patient. We'll remove the outer layer here. Then we'll take our large piece of the tegaderm here, peel it off. We're going to go from one side, and we're not at all going to press down. We're just going to gently allow this to drape over the IV hub there, like so. So we're not applying any force in this area. That's to make sure that we don't cause any pressure ulcers like that. And then our other small piece can be used to just tape the hub down to the patient's skin. And from there on, we have a good patent IV, and we'll go ahead and make sure to document that appropriately. And that's it. Thank you for watching.